After completing the assessment on your patient and determining that local anesthesia will be in their best interest, you will decide what quadrant or sextant to begin that treatment in. This decision will determine what armamentaria you will need to gather to perform the appropriate injection. The term armamentaria refers to all the equipment, materials, devices, as well as methods used during the delivery of whatever procedure you're doing. In this case, we're talking about a basic setup for the delivery of local intraoral injections. This would include a syringe, the anesthetic cartridge, a needle, a recapping device, a mouth mirror, 2x2 gauze and a cotton tip applicator, and topical anesthetic. Let's look at everything you will need to assemble a syringe. We'll start with the syringe itself. They come in several designs as well as different sizes to accommodate small or large hands. The most common design of syringe, and the one that we will be focusing on, is the sterilizable, breech-loading, cartridge-type aspirating syringe. It has a thumb ring, finger grip, a spring and guide bearing, a piston with a harpoon on one end, a syringe barrel, and a needle adapter. The syringe barrel is designed to hold a standard glass cartridge of local anesthetic solution. It has a large side opening that allows for the insertion of the anesthetic cartridge, but also acts as a window to monitor how much anesthetic is given. The finger grip encircles the barrel and piston and is where the clinician holds the syringe between their index and middle fingers to aid in balance and control during the injection. There are two basic types of finger grips, ones with wings and ones without. The thumb ring is attached at the opposite end of the piston where the harpoon is located. Clinicians place their thumbs into the ring to advance and retract the piston. This is where the different sizes of syringe really come in handy. Petite versions that are now available help to provide for more control for those with smaller hands. Oval rings have been designed to make aspirating easier also. The piston passes through the finger grip and attaches on one end to the finger ring and the other end to the harpoon tip. Before loading the syringe, pulling back on this piston will make room in the barrel for the cartridge to be inserted. The harpoon is the part of the piston that penetrates the rubber stopper in the cartridge. If the harpoon is activated correctly, it should not disengage from the stopper easily when pulling back on the thumb ring. This will be important when it comes time to aspirate during an injection. Aspirating is a check that's made right before the delivery of anesthesia to be sure that the anesthesia won't be deposited into a blood vessel. These harpoons are very sharp, and it's actually quite easy to cause injury if the syringe isn't handled with caution. The needle adapter is the threaded surface at the end of the barrel onto which the needle is attached. It is sometimes referred to as the hub or tip of the syringe. Dental local anesthetic needles are disposable single-patient devices. They are identified and color-coded by their length and diameter. Diameter is also referred commonly to as gauge. They consist of a shaft or shank, syringe adapter, and a hub. The beveled end of the needle aids in insertion and helps prevent tissue trauma while advancing through mucosal and cutaneous layers. The opposite end of the needle attaches to the syringe and inserts into the local anesthetic cartridge secured within the barrel. The hub of the needle is the plastic or aluminum threaded portion that secures the needle to the syringe. Some needle hubs will have an identification mark to show the orientation of the needle bevel. Knowing which direction the bevel is facing is important when giving an injection. The type of injection that will be given is important in determining how long of a needle to use. The two most common needle lengths used by dental hygienists are a long needle, which is 32 millimeters long, and a short one, which is 25 millimeters long. The short needles are frequently used for injections that don't require deep penetration, such as infiltrations. Long needles are used when the deposition site is fairly deep, such as the mandibular block. Local anesthetic cartridges are glass cylinders that hold the anesthetic drug. They are also referred to as carpules. The clear glass containers provide easy visual monitoring of delivered doses and unobstructed views during aspiration tests. They're composed of four parts: the cylindrical glass tube, the rubber stopper, an aluminum end cap, and a rubber diaphragm. When placed in a syringe, the aluminum cap fits snugly against the inside of the needle adapter at the end of the syringe. The stopper is placed towards the finger rest end to later be engaged with the harpoon. Cartridges in the U.S. contain 1.8 milliliters of various solutions. In many cases, the manufacturer's inserts, in compliance with FDA regulations, will state that the cartridge liquid capacity is 1.7 milliliters. This represents a manufacturing variation of plus or minus 0.1 milliliter and assures that no less than 1.7 milliliters is present in the cartridge. This won't alter the basic formula for calculating the amount of drug delivered, and it allows for volumes up to 1.8 milliliters of solution, which could be present in any standard cartridge, even if it is not guaranteed to be there. The standard for calculating dosages is considered to be 1.8 milliliters. This is an assumption that increases safety because the average volume of solution in dental cartridges has been found to be 1.76 milliliters. In other words, any particular cartridge is likely to deliver less, but never more than 1.8 milliliters of solution. Cartridges are labeled and color-coded. Both the trade name and the generic drug names are provided, along with drug concentrations, dilutions of vasoconstrictor, the name of the manufacturer, an expiration date, a local anesthetic drug color band, and the lot number with a barcode. Each cartridge should be thoroughly examined before use. Check the expiration date. Dental anesthetics don't have an especially long shelf life, and infrequently used types of anesthetics can quickly expire without realizing. Those without vasoconstrictors have a shelf life of approximately 24 months. Those with vasoconstrictors can last about 18 months. Check for any air bubbles in the cartridge. During manufacturing, small air bubbles of about 1 or 2 millimeters are frequently trapped under the diaphragm when the aluminum cap is put in place. This is not of any consequence, but cartridges with larger air bubbles should be discarded. These can occur when a solution has become frozen or contaminated in some way. If solutions have been overheated during shipping and handling, the contents can appear cloudy or sediments may be visible. Check to make sure that the cap and the stopper are secure and that there are no leaks around them. Discard any cartridges that look compromised in any way.